My name is Patty Roman. I am the Professional Education and Events Manager here with InBrace. I spent almost my entire career in the orthodontic space, which has afforded me the opportunity to be trained by 3 of our country's top consulting agencies, work in all aspects of the orthodontic office, and even spent a portion of my career working for one of the largest dental insurance providers. I'm honored to work for InBrace now, where I can share some of my experiences to help others grow their practice. My co-host and esteemed partner, Erin Deal, she is the National Consulting Manager who leads our team of InBrace clinical experts, who you all know and love, our treatment integration specialists. Erin has also spent her career in the dentistry field with a focus on orthodontics. She has held every position in the orthodontic office, including front office, TC, clinical assistant, clinical manager. And in addition to that, she has worked and has experience with all specialties in the field. She is a brilliant partner and an immense resource in both the clinical as well as the business aspect of orthodontics. So beyond that, Erin is a beautiful soul who truly has a passion for people and their all-around well-being. I'm honored to call her my colleague and true friend. This is Erin Deal.
Thank you so much, Patty, for such an incredible and warm introduction. You're too kind. And thank you all for joining. Before we get started, I just want to let everybody know that as we start the program today, please feel free to utilize our chat function to insert any questions or comments you might have for either of us or our guest speakers. We'll do our best to address any of those questions or comments in real time and still leave some time at the end to also have additional questions come in that we have not had a chance to answer. And from that, I'll let you take it away, Patty.
Thank you so much. So yeah, don't be shy. Go ahead and use that chat function. Now let's dive in. So as a company, InBrace was founded by orthodontists for orthodontists. So we do tend to speak a lot about the clinical aspects of InBrace. What's in it for you? What's in it for the patient from a clinical perspective? Today, we're going to switch it up a little bit, and we're going to hone in on how to position treatment to a patient and what those non-clinical factors are that influence the patient to start their smile journey with you in your practice. So why do we think patients hold off from starting treatment? We know they don't always verbalize exactly what it is. We all know there are certain excuses that patients give. So let's really dive into some of the most common ones. So we hear a lot, oh, it takes too long, it's 2 years. They're on Reddit, they're Google searching all these kinds of things if they haven't had ortho experience previously. They don't want to compromise their confidence or hide behind braces, or they're embarrassed, or they're the people that hold their hand in front of their face as they're going through treatment. There is hassle involved with some treatments, whether it's appointments or taking in and out aligners or going for frequent adjustments. People just don't want to necessarily compromise what it is to go into orthodontic treatment. This may leave some patients to think that, is there actually an option that fits my needs? Do I have to suffer through an uncomfortable stretch of a long time, or do I have to come into the office so many times? There's a lot of questions that they don't necessarily know to ask that we can actually kind of deep dive. So as we know, braces are our provider's tried and true modality, where they're the most comfortable. They know 99.9% of what to expect, how to troubleshoot, what to do when the unexpected happens. On the other end of the spectrum, removable appliances, they look better. They aren't as much work for us on the clinical aspect, but there still is that patient compliance factor that we have no control over. It's going to always be a battle, and plastic does have some limitations. So then there's InBrace. We're a better way to bring together what we all love to do. The best of both worlds we've brought to you with InBrace, with that predictability and also the aesthetics that the patient is craving. So it's important to remember that while the people that are walking through your door, we still consider them patients. They're seeking our clinical expertise when they come in, but we do have to remember one key fact, that they're also still consumers that need to have certain needs met to feel comfortable, satisfied in order to make a large decision that impacts them and their families. So it's really important for us to understand and hone in on what motivates them to make their decisions. The best way to do that is to get to know them as an individual. And then we can get a glimpse into what their lifestyle is and how we can best help them. So now with that information, let's shed a different light. And I'll challenge you to think about our patients as consumers. I know that's hard for us sometimes when we have our clinical hat on, but when doing so, it makes it easy for us to understand which of those non-clinical factors the patient is trying to fill, what information they're actually trying to get from us without asking us those direct questions. So let's take a look at these examples here. Buying a car is a lot like presenting treatment to your patients, really. There are many similarities that we really need to understand in order to recommend which vehicle is going to work best for them. So take, for example, for me. I'm a mom. I have 2 kids. They're both involved in sports, both involved in different sports. They're always on a different team. I'm often bringing them with all of their gear and their friends to games, to practices, to all over the place. So with that information, if I walk into a car dealership, I let my salesman know, and then he still tries to push me into buying that sleek Corvette or that monster truck for 70, 80 grand. I'll likely think they're cool, but I probably won't return because to me, I think they don't understand my needs, or they weren't listening to me and they're just trying to sell what's best for them. So as you can see, not understanding me as a consumer just in the auto industry is very similar to not understanding the needs of our patient and how that impacts their decision when we go ahead to recommend treatment for them based off of their lifestyle. So the interview technique is extremely critical in the consultative approach. So people tend to solve problems as they come, which is an extremely reactive way to deal with the problems. We need to be able to understand and uncover the root cause of their needs and their issues before we actually then verbalize what we feel is the solution. So acknowledgement is super important because the consumer needs to be heard. You need to understand what makes them tick, what drives them. Is it financial? Is it clinical? Is it a mix of everything? Once we know that, then we'll be able to leverage what their why is, why they walk through your door seeking treatment. We'll be able to leverage that throughout the consultation so that we can adequately depict what's going to be best for them. Before we respond and provide some solutions, we truly need to understand some potential concerns that they're having through our interviews. Do they want to see their treatment, or would they prefer that it's hidden? Because we have patients that come in for both. This will narrow down what your recommendations will be, and they won't be off-put by you trying to give them a solution that doesn't fit what they think their needs are. What did the patient do for a living? What's their everyday schedule look like? Are they on the go? Will scheduling be a concern? Will getting them in for their appointments be a concern? Do they smoke or vape? They snack a lot. All of these types of questions can be brought up in casual conversations, even during the records taking process or whatever, if you're giving them a tour of the office, whatever it is that you do in your office. That way, the patient doesn't feel like they're on the hot seat and you're not holding a clipboard acting like an interviewer. So this way, you're going to be able to gather that intel and brief your provider so you can give them critical insight that is non-clinical, that's going to make that patient's journey smoothest and most successful. And when we deliver an experience like that for our patients, that provides the patients exactly what they need for their lifestyle. And they're going to then rave about you to their friends, to their family, online, all of that type of thing. So taking the consumer's needs and wants is super important before we get to the respond aspect. So it goes without saying that working together, we can all make an impact that's impossible for us to make if we're doing it solo. This is why InBrace has a robust team, not only to assist you with your clinical needs, but also to help you grow in all aspects of your practice. So a lot of the information that we're giving you here today can be applicable throughout your office, not only for InBrace. So did you know that our clinical team and business growth partners are highly educated in helping you accelerate your practice growth? Our goal here is not to turn all of your patients into InBrace patients. It's to get those patients who aren't starting treatment by now starting treatment because we're offering them an option that meets their needs. So now we'll dive in and hear from some of our most successful providers and teams around the country.
Thank you so much, Patty, for your presentation. That is going to lead us into our next segment with our guest panelists. Our first panelist that we're going to hear from today, I'm honored to introduce her, Ms. Tracy Wright, Treatment Coordinator for Dr. Jennifer Shulsky at Virginia Braces and Invisalign Center. Tracy, thank you so much. Welcome to this webinar. Before we get started, if you could just, just give us a sneak peek into your experience, how long you've been with Dr. Jenny as a TC, and what's your background overall in your career?
Thanks for having me. I've been with Dr. Jenny for 2 years. Prior to that, I've been in the ortho field for 20. I've been the TC and office manager, and enjoying every bit of being a TC for an orthodontist office and being an office manager.
Great, that's amazing. Thank you so much. Give us an idea of what a typical day for you looks like as a TC for Dr. Jenny, and what a consultation in your practice looks like.
So when a patient signs in, I go out and I greet them. I take them back to the records room and get their x-rays and their photographs, trying to make conversation with them, finding about, what brought them into the office and what their concerns are about their teeth, what they've heard about ortho. So gathering as much information during that process as I can while we're going through the records process. I then take them back into our consultation room. And by that time, I'm usually showing all 3 of our modalities that we have for treatment. So they're aware of what we have to offer, letting them know that Dr. Jenny will come in and do an exam and give you her recommendation for treatment. But I like them to be able to see everything, to hold the models in their hand. Talking about treatment times, I've gotten very comfortable with that with Dr. Jenny's guidelines on telling patients about that. Then I'll go out and meet Dr. Jenny and kind of give her a recap of what's going on in the room and what she can expect in the room. And then she comes in and does her exam with me.
Okay, so when you are briefing Dr. Jenny, what does that briefing look like? What is the information that you're relaying to her based on the information that you gathered from the patient during the records taking and your conversations with them?
I will let her know what their expectations are, what their chief complaints are. If I've learned anything about their lifestyle, I will share that with her. Trying to give her as much information as possible before she goes into the room.
Usually she'll prompt me they've had orthodontic treatment before. Maybe it was 20 years ago, maybe it was 5 years ago, but that's always kind of talked about as well.
Okay, awesome. Do you typically go over pricing of the modalities before you bring Dr. Jenny in, or is that a conversation that comes up after?
I do not go over pricing, the exact amounts. I do try to explain to them to not get hooked up on the pricing, that the modalities that we're going to show you, that I can show them that the cost is pretty much the same across the board. If for case it's an insurance that it's not, I will prep Dr. Jenny ahead of time before she goes in there, so she's aware of that too.
So the cost is after I leave.
But
Okay,
I
awesome.
get fear out of don't get hooked up on this is going to be more. So I kind of relieve that so the patient knows that up front before she comes in.
Understand. So when it comes to based on what you've just said regarding how you guys, go about pricing and presenting it, do you find that pricing is a factor on, a patient deciding the modality that, which modality is the right one for them?
If they've shared some patients, that is, but we have a 2-tier pricing system. So we have a tier that if it's going to be over 12 months, we have a certain price, and then under 12 months, I go by a key word that Dr. Jenny will use during the exam. So I know what fee that they're going to have when they walk out of the room. We have to communicate with that beforehand.
Okay. All right. Sounds good. And so, you guys obviously you said you present everything to the patients. You're presenting all the different modalities that you offer, which are traditional aligners and also InBrace. Most patients pretty much know a lot about traditional braces and aligners. For some patients, InBrace is something that's different to them. So what are some of the most common questions that patients and consults ask about InBrace?
They really ask over and over again, this really can be done in 12 or 14 months. I really can get out of treatment and not be in that chair. And they'll ask before she comes in, and then she will express it to them, and they will ask again when she leaves. They've had some issues with kids wanting colors, but Dr. Jenny solved that issue, so they can still have their colors with InBrace. Dr. Jenny can tell you what she does with that.
And then the only other thing is they always ask, like, does it hurt? And we just go over anything in orthodontics, no matter what you do, there's an adjustment period. And I point out the adjustments of each modality.
And we
Okay, I
also,
love that.
it doesn't matter what they do, they're going to have something on their teeth, whether it's a button or they're going to have something on their teeth.
Yep.
It's so true. There's an adjustment period no matter what option they go with. So, in your experience, as a treatment coordinator who went from not, working with InBrace, how did you feel, or what were your thoughts surrounding InBrace when you first heard about it from Dr. Jenny?
I was a little nervous, but the more that you guys helped us with it, I can tell you, and I tell patients, I've been doing this for 20 years, and there has never been a product out there that I just want, oh, wow, this is amazing. And I share that with our patients and tell them that how amazing. I tell them that, patients are coming back for their second arthrobonding and the differences they see in that short period of time.
I love that. So you really highlight, that they are able to watch their progress as they go along. That's fantastic. Were there any resources that you used, when you first were introduced to InBrace that helped you feel really confident speaking about it with your patients?
You and Dallas were a huge help with that, teaching us the right wording and teaching us about it was a huge help. All of our technicians, and even during our interview process, we send all of our technicians to training, and they come back fully knowledged, and they're actually helping me in the practice sell InBrace. We even allow our technicians, we have it to be a year before you can have treatment with Invisalign, but with InBrace, if they have been out to go through the course, even in their 90-day probationary period, we let them start with InBrace. And that's a huge help to have somebody in the office that has InBrace in their mouth and can come in and talk to the patients with me.
And I just want to point out too, so like InBrace, it's just like brackets and wires. So it provides you quicker treatment, but people shouldn't be afraid to talk about it because it's the same as any other treatment modality, just gets you there quicker. So it's exciting to talk about, but it should be easy to talk about because it is just another modality to get you to where you want to be.
I love that, Dr. Jenny. So now that you do have this experience, Tracy, and you've, come so far, being able to verbalize it, presenting it to patients, what advice would you give to a TC that is just starting out with InBrace?
To get on board with it right away. It is a super easy sale for patients when you tell them that you're going to be out of treatment quicker, you're going to spend less time in the office. And I would tell the TC, your doctor's going to be less at that chair and you will have more time with your doctor for other things. And to use, like I said, use the support that's out there.
Thank you so much for, just sharing your feedback. Thank you for sharing your insight into your everyday experience as a TC, your process as a TC, but also just your a TC that is passionate about an InBrace and that has, brought it into a practice and learned all about it too.
Well,
so thank you so much
for all your support.
We appreciate you. And with that, I'm going to segue to Dr. Jennifer Shulsky. Dr. Jennifer Shulsky, I already mentioned it. You're with Virginia Braces and Invisalign Center. I'm going to ask you to just, tell us a little bit about yourself, your schooling. How long have you been using InBrace? How did you get started with InBrace? And then what also motivated you to bring InBrace on into your private practice that you're in now?
Awesome. So Jenny Shulsky, nice to meet everybody. I started with Virginia Braces in 2022. We're in Arlington, Woodbridge, and down in Stafford. I actually started with InBrace back in 2021. I started out learning it and joined a corporate general dental practice that they had like kind of a niche where they wanted their orthodontist to just use InBrace. So keep in mind, I learned InBrace as a Gen 1 provider. So if you guys ever read any negative comments, it's all Gen 1. And I'm not going to lie, there was a steeper learning curve with Gen 1. But having learned and seen how great the progress was, even with Gen 1, I knew that I had to keep doing it. And so what I want to point out to everyone here is that I actually joined Virginia Braces just as Gen 2 was being rolled out. So I really didn't have that much experience with Gen 2. So if you're thinking to yourself, I don't know if I'm going to be able to learn this, I don't know like how to change the wires, I don't know how to do all that stuff. I didn't really know how to do that with Gen 2, but I knew how well it worked. And the one thing I really left my last practice with was the knowledge that patients now loved it, where it wasn't uncomfortable and it still had all of the technology that it did in Gen 1, but now it was comfortable. So that I joined Virginia Braces knowing all this and was thinking to myself, well, great, I'm gonna have to relearn a whole new system. And so I contacted Erin, got her involved. We got our staff started getting training. And in my mindset, I'm thinking to myself, well, I'm going to have to start off slow again, figure out how this works. And, I did a couple patients and I started changing the wire myself. And I'm like, wait a minute, this is everything but easy. So there was everything is done for you. It's so easy to change the wire now. It's so easy to treatment plan. The software is so great. So for me, incorporating it into Virginia Braces was just a no-brainer. And so I'm going to keep encouraging everybody. It's almost like a secret that's really not right that we have this. And so we kind of want to share this as InBrace providers.
And look, we have a patient when they say, we're going to go home and research it. We're transparent. We're going to tell them you're going to see some things out there, and it was on the Gen 1 bracket. So we're upfront with them and let them know you're going to get those bad reviews from that.
Yeah, I like how you're upfront and you just really set very good expectations with the patients that you see in your office. We were able to hear from Tracy and she gave her perspective on the consultation. I'm going to ask the same of you, but before I do that, what's the typical age demographic in your practice?
We have an 80-year-old and we have 7-year-olds. So the range is there. And so we see just about everybody.
And so Tracy, she talked about like her process, greeting them at the door. She does the record. She has all those conversations and then she's going to brief you. But at what point in that process do you actually come in to the consultation?
So I come into the consultation for purely the exam part. So I'll perform the TMJ exam, the intraoral exam. I like to do that at the chair side, just with the patient, and then gaining my knowledge of like what needs to be done. I kind of formulate a treatment plan, and then we start going over the modalities.
Okay. And so in that briefing that Tracy is giving to you, in your opinion, what is the information that is the most important to you and why is it so important?
Have they undergone orthodontic treatment before? And then, kind of what, like, if it's she'll come out and she'll be like, there's a lot of space between the front teeth, or they seem class 1, or she'll be like, there's a surgical. She's been doing this for 20 years, but for me, it just kind of prepares me like treatment plan wise, like what I'm kind of looking at. But the biggest thing for me is, have they undergone orthodontic treatment before?
Okay. And why is that so big to you as a provider?
Because orthodontics with InBrace is not what it used to be. So when you use InBrace, you're not giving InBrace to everybody that used to do Invisalign with. You can still do plenty of Invisalign. What you're doing is you're opening the door to a whole different group of people that are in your chair, mostly because they've done Invisalign or whatever aligner it is. And they still want their teeth straight, but they're in their mind, they're preparing themselves like, maybe I'll do braces, maybe I'll do braces. But when I provide them with another aesthetic option, many times people's jaws are on the floor. And so it's like, you mean I don't have to do Invisalign? It doesn't work for me. So I thought I was going to have to do braces. So you're literally providing a whole group of people treatment that otherwise would not really do treatment again.
Mm-hmm. Mm-hmm. And so when it comes to recommending, Tracy mentioned that a big part of her when she is talking to the patients during that records phase, that she's, gathering information about who they are, what their lifestyle is, asking all those questions so that she can relay that information to you and you can make the best recommendation, clinically and based on their lifestyle. So when it comes to recommending the modality that is right for your patients, how comfortable are you with recommending InBrace as one of those modalities?
100% comfortable. And like I said, if you're thinking about doing InBrace, start off small, start off with whatever, because you're going to quickly see that you can provide it. And I encourage you to like jump off, do it, and then get started and just keep doing it, because you're going to see that it does everything that brackets and wire can do, and everything that you wish Invisalign could do, InBrace can do. So I'm very confident offering it.
I love that. What are some of the apprehensions or questions that you hear from your patients regarding each modality? Not just InBrace. You said that you've got patients who were, previous orthodontic patients, and aligners are some that just have never had treatment. So how do you navigate those apprehensions with each modality?
So a lot of people are afraid that it's going to be sore, afraid it's going to hurt. And I just, kind of get those out of the way. Like it's, anything you choose to do orthodontically. And another big factor for people is that, we practice in areas like up in Arlington. A lot of it is like young professionals. They don't even know where they're going to be in 2 years. So to tell them that they could have and be done treatment within a year, maybe a little more, that's easier pill for them to swallow. Let's put it that way.
Mm-hmm.
And so that is a big hurdle. Just people can't fathom in our society today, like 2 years from now, like that's just huge. A year, that's a lot easier for them to do. So those are the big obstacles is it going to hurt? And, the fact that they're not going to be in treatment forever and a day.
Mm-hmm. Do you have any apprehensions or concerns, when you're discussing traditional or even, the other modalities, aligners in your practice as well?
The biggest thing with aligners is obviously like they just don't know that they can commit to it.
Mm-hmm.
So the way that I frame InBrace is that you're putting all the work back on me as an orthodontist. So when you're in aligners, you do all the work as the patient. So let me do the work for you and let's get your teeth straight.
Awesome. And so after you've addressed all those concerns, those apprehensions, and you've explained everything to the patient, have you had a patient that you've presented InBrace to as an option that has not chosen InBrace?
Yes. And the fact though that they could choose, they had the options, and they felt that they were making the decision to do an Invisalign option. I think it really empowered them, and it empowered me as a specialist because I had all the options available to them.
Mm-hmm.
That's going to be the biggest group of people that you're going to really touch, are the people that went to the general dentist and was going to get general dental treatment, came to me as like, I wanted to just see a specialist just to make sure, like in their mind, I feel like their mind is already made up and they are going to get treatment at the general dentist. They just want to make sure that the specialist, is kind of on board, like see what I say. And so the fact that I can offer InBrace and they know, okay, well, I'm gonna be in it longer and I'm okay with that. But the fact that I offer InBrace, it legitimizes me and it validates me as a specialist. And so that is very empowering to us as a practice and to orthodontists as a specialty. So the fact that, yeah, all the time, there are some people that just want the freedom to be able to take it out. That's the biggest thing. They want the freedom to be able to take it out. I always tell them if they take it out, it doesn't work, but that ability to actually physically be able to take it out is normally why they choose it. But I notice that they choose us because over the general dentist, because they understand why I'm a specialist and why they should be there.
As they should.
Yeah.
And then, and this is a question, I guess, for both you and Tracy too. When you're in the consults and you are presenting InBrace as an option, being that so many people have never heard of it before, do sometimes they ask you if it's a new modality? Is it new technology?
We get
And
that
how
a
do you
lot.
address
A
that?
lot in our consultations.
I love that question because I get to geek out a little bit. And I love to say stuff like, you know, lingual braces have been around since the 1980s and they use nitinol wire, which was developed in the Naval Lab in the 1960s. And I always just frame it as InBrace, the inventors of InBrace were genius. And they developed the U and the wire to make it comfortable for patients. So now it's become more of a modality that all orthodontists can provide and patients are willing to do because now it's comfortable. So I just go over that this technology has been around since really the 1960s, but it's gotten comfortable.
No, and to be able to tell patients that they can get in there and they can floss regularly, they don't have to use the floss threaders, that you can just floss like normal, and it's awesome.
It really is. That was a big thing for me.
Yeah, and the fact that people know that we're using technology that's been around, it's not some experimental thing, that makes them a lot more comfortable.
And I love that you
acquired 2 patients from the previous orthodontist, and they were in Invisalign and their treatment had just gone and they finally kind of gave up on it and stopped treatment. Well, they both come back and they're doing InBrace and they are just blown away at how easy it is and how their experience is going. So
it's been a much easier transition for them.
yes.
And I will say
Fantastic.
one of these patients have very large lingual tori, and despite that, because she works as a salesman or salesperson, and so she could not have braces, like she could not. And even despite that, even despite the fact that there's very little room back there, she comes in, she's like, I love this. I love it. I'm like, really? You don't have a lot of room for your tongue back there? But she's like, I love it. My teeth are straight. In 3 years, my teeth are straight. So
That's fantastic. So, Dr. Jenny, is there any specific malocclusion that you feel InBrace is, you know, your ace in the hole, that it really gets you what you are looking for?
I love it with open bites. I love it with space closure. I love it with rotation. So here's what I would tell you as a new provider, somebody thinking to coming on. Honestly, anything that you wish that you could do with regular braces, but you know your adult patient's not going to do it, or even that you wish your adolescent patient would wear their aligner, whatever it may be, and you wish that brackets and wire could do that for you, InBrace will do it. So those canine rotations, those lateral rotations, that is so clutch for me to be able to use InBrace. And then, you know, open bites, it's great. I'm just going to be upfront. I mean, my experience with aligners and extruding teeth, it's just not, it's just not there. So anything that you wish you could extrude, InBrace can do it.
And
Thank you for sharing.
as a TC, listen to your provider talk and learn the lingo that she's speaking, because I'm able to say a lot of this before she ever even comes in the room. And I say, now keep in mind, I'm not the doctor, but da da da, and I go over all this, and then Dr. Jenny comes in and just says it again. But listen to your provider talk, and you just kind of learn the lingo with it. And
That's great advice, Tracy. I think we all learn well from each other. So I love that you mentioned that. Let's talk about your team, and you had a team that wasn't with you at your previous practice, so you brought something in that was completely new. Tracy obviously picked it up very fast, feels very comfortable. She shared how comfortable she is. How about your team now, your clinical team, and also your front office? How comfortable are they with InBrace?
Very comfortable.
Yeah, very comfortable. I have Tara, her, come on, what's Tara's position?
Oh, lead
A
assistant.
lead assistant in the back. She'll sit up front when somebody comes in. She's already talking about InBrace forever and bring them up into the back.
And I'll point out, so when you're first getting started, try to get everybody cross-trained in it. What you don't want to do is have like one person that's trained and then that person calls out and then you have to cancel. You need to treat it like any other thing. Does everybody know how to do brackets and wire? Does everybody know how to bond Invisalign? So, and InBrace is there to support you and train your staff. So just use them.
And don't be afraid to send them for training and go, well, I'm afraid they might not stay with me. When we sent our new employees, they felt valued that we thought enough of them to send them to go get the training.
Talking about the training, yes, you guys have sent your staff to our training, but is there other resources that you guys have been able to utilize and found to be very instrumental in integrating InBrace into your practice?
Yep, all the videos on the post-op instructions, the videos are really helpful. If I'm treatment planning a case and I have any questions, I can schedule a time to speak with a treatment coordinator, a treatment provider, an orthodontist who will help me treatment plan the InBrace case, and they'll point out things like take out this overcorrection, like they'll guide me through it. So it's just a no-brainer. Like if you need help, they're there.
And for me, listen, what I'm saying, okay, the staffs are having some weakness in things, giving them the videos or calling Dallas and saying, hey, can we get some additional training here? And you guys are always right there for us.
Love that. Let's talk about messaging. You said how Tara, she talks about InBrace as soon as patients walk in the door. What measures do you take to ensure that your entire team is fluid in their messaging surround InBrace, and also seeing your vision?
We just, our morning huddles, we have a morning huddle every morning. We kind of discuss what the day is going to look like. Every new patient that walks in through the office, very friendly. We all have an understanding that, if the patient can do InBrace, we usually provide InBrace. We just everybody's trained in InBrace. So everybody knows. And so it's like not one person or one assistant or a couple people, like everybody should know how to do it.
And speaking of your team, I had the opportunity to meet your whole team yesterday. They're amazing. It's clear that they have your vision, that they see your vision and are with you in it. And so being that you do have such a great team that is such an integral part of your success as a provider, as an InBrace provider, how does that translate into your everyday life? How do you make InBrace really work for you and give you the opportunities to do other things, in your practice? What other areas of opportunity have been available to you because of the efficiencies with InBrace?
Well, my Fridays are getting a lot lighter because I used to spend those redoing my refinement. So when I tell you these cases finish quicker, like I'm not lying to you. And so I just get tired of spending so much time. And it's not that that aligners don't work. It's that people don't wear them. And so it just frees up my time as a doctor to, explore other venues. I'll share it with everybody. I recently got Botox certified. We're thinking about, we're providing it here as a TMJ and headache treatment. And so I would never have had time to do that. Like I was so overloaded with some of these cases and all these refinements. It's freed up my time in that aspect. And then chair side, when we have broken brackets, broken wires, a lot of the stuff is delegated to the assistants. So, you know, the efficiency is there as well. I don't have to run over and, you know, take time or bog down my schedule. The bracken can be rebonded right there by the assistant.
I love that. And
A
Tracy,
lot
from a
more
TC
free
perspective,
time to plan with me and,
Yeah.
and I love that.
yeah, and also from a TC perspective, now that Dr. Jenny has more time, how does that relate to you as a TC as well?
We're actually adding more new patient exams in because she has more free time. So we're
Mhm.
able to double book our new patient exams now.
So I took over for a retiring orthodontist, and so he was truly retiring, so his numbers were going down. So we really are using this as a practice builder as well. And what really should have taken me 2 years to rebuild, I mean, it's rebuilding much quicker because of InBrace, and it's kind of, you almost feel guilty as a provider because it's so easy and nobody else wants to use it. So it's just like, all right, keep sending my way. I don't mind.
Well, I love all this, Dr. Jenny. And I'm going to ask you one final question. With all that you know now as a seasoned InBrace provider, what advice would you have given to yourself if you can go back in time? But also, what advice would you give to a provider that is new to InBrace and also their teams?
So if you're nervous, just start with maybe one patient. You'll see what it does. Once you see what it does, just do it. Keep doing it and do it often. Just keep doing it because you're going to get very comfortable with it. It's just like anything else that's new. You know, if you just started Invisalign, like you have to let yourself just do it. And then my second thing is use the resources that InBrace provides because, you know, get your staff trained. You don't want to bog down your schedule if somebody calls out or whatever happens, life happens, and you don't have that assistance that's the InBrace assistant. Treat it like anything else. Does only one person know how to do Invisalign? No, everybody knows how to do Invisalign in the office. So get everybody trained, everybody on the same page. This is just a different treatment modality. So that's just the way that you need to kind of think about it.
Well, thank you both. Thank you, Dr. Jenny. Thank you, Tracy, for being a part of this webinar. We appreciate you as a leader within the InBrace community and all the insight that you have given today. Thank you so much.
Thank you.
And on that note, I'm going to introduce our next guest panelist. I have had the pleasure of working with this young lady many, many times and, you know, see her growth. So I'd like to introduce you all to Miss Bella Zumo, who is the clinical manager at Horsey Orthodontics for Dr. Gus Horsey. For Dr. Gus Horsey. So Bella, tell us a little bit about yourself, how long you've been in orthodontics, and what roles you have previously had, whether it's in the industry or outside of the industry.
Yes, so I've been in ortho for 3 years, and I've been with Dr. Horsey for those 3 years. I started as a student with his practice. I started as an assistant, and then I was the trainer, and now I am the clinical manager and the lab manager of our locations. But before that, I was actually working in general with hygiene, assisting a hygiene.
Okay. That's awesome. So you came to Dr. Horsey's practice. Dr. Horsey is also an amazing leader, you know, of embracing lingual orthodontics in the orthodontic community. So coming there, you know, from outside of the field, what was your first impression of InBrace when you were introduced to it at his practice?
At first, I was nervous because I had to learn facial systems. So I was learning facial systems and lingual. So I was a little nervous because I didn't know anything really about ortho. But once I saw it, I got more comfortable and really wanted to learn it because it looked really cool to me.
Oh, I love that. It is so cool. And so what was your experience learning about InBrace and working with it?
I think I started learning with Gen 1, and what helped the most was you guys coming to the office and doing trainings. It was a little bit nerve-wracking at first just because you're always trying to make sure that you're not slipping and making the patient comfortable. But using all the resources like the videos and helped, and then having all the other team members that already knew how to do InBrace helped with any questions that I had.
That's great. Were you able to attend a training as well?
Yes, I did attend it last year in Dallas in April, and went through that Gen 2. It was amazing. I learned a lot more than I knew previously. So I'm very lucky that I got that opportunity to go.
And would you say that, working on InBrace, has it also developed your clinical skill, just as a clinician overall?
Yeah, just because like being like, dominant hand is your right hand, and with InBrace you have to use both hands. And I think learning how to use my left hand with things made it easier to do different skills with, facial, like holding multiple things at once and doing multiple things at once with both hands.
Yeah, so you become ambidextrous, right?
Yes.
Very cool. Dr. Jenny and Dr. Shulsky really shared like how, it's delegable. So, for you as a clinical team member of Dr. Horsey's, walk me through what a typical InBrace appointment looks like for you. What is your role in those appointments? And what exactly what do you need to wait for Dr. Horsey on?
So usually, we'll have the patient seated, we'll ask, if they have any questions or any concerns about their treatment, before I look at anything, and then I'll double check all the brackets, the wires, make sure they're all good. We do the adjustments, the bondings. We call him over to, complete any IPR that's needed to double check the progress of the wires, and then just give us any additional notes for the next visit. And then if he has to do any direct bonds, we'll call him over before we finish the appointment.
Okay, so from start to finish, your role is really, integral, a big part of those appointments. Just like they shared, it's very delegable, and that has freed up Dr. Horsey significantly too.
Yes.
You're in OA though, you're seeing those patients in the chair, and I'm sure you get plenty of questions after fitting, from a patient with InBrace. So what are some of those questions, and then how do you address them?
Mainly the questions are how long is it going to take to get adjusted to them? Like, what are the guidelines with eating, hygiene? And usually, if they have those questions, we go over the post-op instructions. I do tell them that everyone is different. It depends on, your pain tolerance, and the way that you can handle pain. So sometimes it takes, up to a week. Some people are sooner, some people it takes a little bit longer, but it all depends on that patient, on how soon they can get adjusted to it.
Okay, so what I'm hearing when you're saying that is that it's really similar to what you would, tell a patient for traditional braces even. And you're really setting them up for success by giving them those expectations. I love that. Now you guys are really seeing patients from all modalities within your practice as well. So, while you're in the chair with the, patient that's maybe in traditional or even aligners, is there ever a time where they have a friend or a family member accompany them, and they ask you about InBrace, or maybe even when you're walking a patient up to the front desk?
Yeah, there's a lot of times that they do that. It's mainly like with the parents that come in and they see that their, sons or daughters are in treatment and how well that their teeth are moving, and they want something that they can get but don't want to see. They don't like those braces when they smile or when they talk, just because, in their career as adults.
Yeah. And so, as a clinical assistant, I know how busy it is, where you're like, all right, I got to get moving. I got to keep going. So how do you describe when they're asking you about InBrace? What's your quick response to tell them what it is, considering that you are very limited on time?
I just say InBrace is a system of braces that are hidden. If you don't want anyone to know that you have braces, then this is the right system for you.
Love it. Love it. And, the last question that I'm going to ask you is, as a clinical assistant, with the experience that you have gained over the years now working with InBrace, what would be your advice to other assistants that are just starting out with it?
Take your time because it's not something that can be learned really quick in like a day. So not to feel discouraged if you can't get it right away, because patience is key with learning InBrace. Speeding through any trainings or appointments will make it a lot harder and easier for mistakes to happen. Watch and use all resources that you have because it will help a lot with learning it.
Well, Bella, thank you so much for being a part of this as well. I appreciate you joining and just seeing where you are as an InBrace assistant now. It's amazing. All right. So on to our next guest panelist. I have had the honor of working with this man many times as well. So I would like to introduce everyone to the man, the myth, the legend in the lingual orthodontics community, Dr. Gus Horsey, owner at Horsey Orthodontics in Richmond, Virginia. Dr. Horsey, tell us a little bit about yourself, your schooling, any accolades, how long you've been using InBrace, how you got started, and really what motivated you to go all in with InBrace at your practice as well.
Yeah, thanks so much, Aaron, for having me. Thank everybody for taking out time today. So like I said, my name is Dr. Gus Horsey. I attended the University of North Carolina, where I went for undergrad, dental school, and residency. And during our residency, we actually got introduced to a lingual system at the time that was called InBraces, that 3M eventually bought and turned into Incognito. So that's my first exposure to anything lingual, because I hadn't really trained on anything before that. And from there, I kind of sparked an interest in lingual because I thought, one, it's a nice technology. Even at the time, it was ahead of other technologies. And then also it had the ability to treat patients that otherwise would not seek treatment or would just kind of compromise treatment and go with something that wasn't really for them. So that's really sparked my interest since then. I also get an opportunity to teach at the growth and development orthodontics at a pediatric dentistry residency program in town. So that kind of helps me with teaching, which I love to do as well too. So my introduction to InBrace is I was doing lingual since 2010. So I had done about 1,000 lingual cases and had kind of fallen out of favor with the product because it wasn't progressing as it should have, and really just kind of started to hear a buzz about InBrace on social media and from other lingual providers that I had spoken with, and really just started to hear about it and research it and found out, like they mentioned earlier, it's an orthodontic company founded by orthodontists for orthodontists, founded off of a research project in an orthodontic residency program. And they really are geared towards making orthodontists successful in InBrace and their practice. So from the first contact I had with Matthew Wang and Aaron and John and everybody in the company, I really could tell that they were 100% for our success as providers, which unfortunately other companies don't provide that type of support in this field. So from there, we started with an on-site training. I myself got bonded up with InBrace Gen 1, so I survived. But that was a really big kind of differentiator for a couple reasons. And one of the main things I recommend providers do is bond themselves. One, you get to feel what the system feels like, so you can describe it to the patient and to the parents. Two, your assistants get somebody to train on at all times because you're at the office at all times. And then it also gives your patients more of a sense of like, oh, okay, the doctor's doing it. He's talking with it. I know somebody who has it on. And it really kind of breaks down those barriers that some people have to what they see, they see as a new technology. So yeah, I've been doing InBrace since 2018, 300 plus cases at this point. Love it. Love talking about it. Love, training assistants on it like Bella, who's been amazing. Love talking to parents about it, patients about it, everybody. So really love the company. I think that's the really heart and soul of the product. But the product's amazing. The company's amazing. So it's rare to get that combination. So yeah, that's why I'm all in on InBrace.
Thank you so much for sharing that feedback with us. We'll get right into it. I asked Dr. Jenny about her consultation process, so I would like to ask the same to you. If you could just walk me through what a consultation at your practice looks like. At what point do you also come into that consultation as well?
Yeah, so very similar to Dr. Jenny, our TCs will gather records, talk to the patient about lifestyle, what they're looking for, their chief complaint, any preferences in treatment. They'll also discuss all the systems, just because even though they may not get aligners, they may not get InBrace, they may have a parent, a sibling, a coworker that we want to explain the systems to them so they know what we offer. So the TC will go through that, kind of get a sense of where they're at with that, show the records to them, point out the obvious things that they can see, so that they can start to kind of plant the seed in the patient's mind on what to expect as far as treatment. And then the TC will meet with me usually in my office. We'll sit and go over the records together. They'll tell me the report of what they found out, and then I'll give the TC the treatment plan and diagnosis so that we can write that down. And then I go over the consultation, show the visuals. We like to use Dolphin Aquarium and videos to kind of show different things, because that visual helps a lot. And then the TC will come in and go over fees and everything like that. So we have the Typodons out so they can touch and feel the systems, see what they look like, feel like. I give my opinion on kind of different systems, since I've literally gone through every system that we offer, as far as my own personal experience as well as patient experience. And then pretty much if they do ask kind of what do I recommend, I'll give them the recommendation, because a lot of times they'll be caught between a couple systems or something like that. But we try to match lifestyle and diagnosis with the systems that we recommend.
Okay. And then as far as like when your TC is coming to, debrief you on their findings, what piece of information is the most important for you, when you're going back and having those conversations with the patients?
Yeah, it really comes down to what the patient's chief concerns are. And it may not always be like, I want upper right 3 to derotate. It may be like, I want my smile to be broader. I want my, I'm biting down too hard, or I feel like my jaw's fatigued, or I've never really liked kind of how this side of my mouth looks. So it really kind of helps me understand where my treatment plan can go, as well as what systems may be available to help them the most. Like we had mentioned earlier, their lifestyle has a big contribution to what systems may be best for them. I know I can finish them quicker in InBrace. I know it'll be aesthetic. It's just a matter of whether or not that's a system that they prefer, or if they're really hooked on one system or another. So yeah, we try to find out chief complaint and lifestyle are the biggest ones for us to understand, so that I can match them with the best system for them with my recommendations.
Okay. You've been doing lingual forever. You've been doing InBrace, since 2018. So we know how comfortable you are recommending it to your patients. I do want to ask though, what is the youngest age of a patient that you treated with InBrace?
Yeah, I had a 9-year-old mixed dentition patient that we treat with InBrace. And again, it's a customized system. So when people think like, oh, how young can you go with lingual versus facial? Like it's the same system, like Dr. Jenny was saying. It's just a matter of how you plan it out. So of course, if you're waiting on teeth, you would either create space with the system or move the teeth that are currently in position and wait for that tooth to emerge. We've done impacted teeth with InBrace and all other things. So it's just a matter of using this really advanced tool to be able to treatment plan and get the results that you want. But we have a tool that we've never had before. So it's really cool to have that in our toolbox to say, oh, I know I can do even more, because this tool can actually get what I have in my hand out in the patient's mouth as a result.
So when you do present InBrace as an option to your patients, what are some of the questions or apprehensions that those patients have after being presented with it?
Yeah, a lot of them haven't heard about the system or seen the system up close. Some of them will be worried how the tongue feel on it. So that's when I explain to them my own experience, as well as the different experiences with Gen 2. They ask a little bit about speech. We'll let them know about the rainbow passage. And, most patients within a couple of days to a week or two really don't have any speech issues, especially with the newer generation. So speech isn't really a concern anymore for patients. And then sometimes it's cost, and we go over that at the very end, as far as how the cost will be and pricing. And each office is different depending on how you want to do it. I think if you price it very similar or the same as your regular options that you have currently, you'll find that patients will choose it more often, and you'll be more successful because you'll get the repetition and be able to see more cases, and your learning curve will be a lot better.
And then speaking of, addressing those questions or concerns, and the patients, you know, not being familiar with the system, how do you address the question if it does come up, if it's a new technology?
Yeah, so same thing that Dr. Jenny was talking about. We like to talk about it's not a newer technology as far as like mechanics. So this actual system of moving teeth was, you know, done many decades ago. However, the technology has caught up to make it comfortable, predictable, efficient for the patient. So now we can utilize this tool for more patients, and it's more comfortable and more accepted. But the actual mechanics of moving the teeth from the inside out has actually, you know, been done for a long time. And even in a course recently, that I had with dentists, I asked them, I said, do you know why braces aren't on the inside, they're on the outside? There's really not much advantage from being on the outside. The only reason it was on the outside is because initially they had to be bands and they had to be accessed, and they had to be bonding, and it was easier to access and bond on the facial. Well, the lingual actually gives you some advantages as far as center of resistance and being able to move teeth, and actually a cleaner environment with less or zero, you know, risk of white spot lesions and everything like that. So it actually is a better environment to place them on the inside. It just was never done because the technology wasn't there yet.
I was there that day, and I loved how you brought that up, and I learned something new as well that day too. So I thought that was fantastic. You know, is there anything specific that you feel InBrace does better than other modalities in your hands?
Yeah, the space closure is huge. Deep rotations. You're basically getting all of your movements in your first wire. So your tip, your torque, your space closure, your uncrowding, your derotation is all done at the same time. So we see things that movement wise are literally impossible in bracketed systems, no matter what system you're using, whether it's a customized system, self-ligation system. You can't do that with those systems because of the wire length, the locket design, the interproximal loops. InBrace has the advantage of moving those teeth and closing spaces quicker than you can with any other system, because you're not waiting for your leveling and aligning and rectangular wires and steel wires and all that. So space closure, reducing protrusion happens so quickly in patients as far as Bimax protrusion patients. So those are two major ones that we see. We can get into we get into elastic sooner as well too, because we're not having to wait to build up in wires for a year and a half or so.
And then what else? What also would you say is your biggest bang for your buck? You know, with InBrace.
Yeah, I really think it's the overall chair time. So, and me as the doctor, I'm not stuck in the chair, or I'm not, you know, the only one who knows how to use the system. My team is amazing. Again, they do 99% of the appointment. I'm only there to do the part that I have to do, like the IPR, but they're educated and trained enough to know to look for bite interferences, to look for wire engagements, to look for loose brackets, to look for springboards that are disengaging. So they're very highly educated and trained into looking for that, which frees me up. Plus, the chair time for them is a lot less than other lingual systems, so it is a quicker chair time for them even as well too. It's more comfortable for the patient because the appointments are quicker, and we're able to space out appointments 12 weeks or longer, as far as, you know, when they have to come back, because we're not replacing a O-ring, or we're not like changing out a wire to keep the system going. It's going to keep going.
And so just, you know, touching back on your team being able to do 99% of the appointment, and you said that that's really freed up your time. What are some of the other areas of opportunities that you've had become available to you because of that free time?
Yeah, it's really helpful because, again, with other systems like aligners, you have to do your clean checks and all that, so you have time to do that. But you're not, you know, doing those continuously with the InBrace system, because usually you'll have one, maybe two refinements and the smile design, and that'll be it. You're not having to like communicate back and forth about your aligners and do all that. So it really frees up for a lot of the admin stuff that you have to do on the side, as well as it frees up your schedule, meaning you don't have to schedule out an hour and a half for a lingual appointment like we had to in the past, because the appointments are quicker and they're spaced out longer, so they're not, you know, seeing every 4 weeks or so. So that's really freed that up and helps us kind of get our chairs turned over and more patients in the door.
Okay. And then as far as your staff with their comfortability with InBrace, It sounds like, for the most part, your staff is pretty comfortable. A lot of them are trained in it, but also how about your non-clinical staff, your front office staff? How comfortable are they with InBrace as well and speaking about it, talking to patients about it?
Yeah, I think they're very comfortable since we've been doing linguals for 14 years and InBrace for 6 at this point. So people that have been here for that long are just know as part of our practice, and it's know that's something that we offer that a lot of patients have. They understand how when patients call in, either for their appointment or if they have a repair appointment, they know how to treat it differently than traditional braces as far as what to tell the patient if they do have a concern. So from the phones to TCs to everybody within the office, I think they're well versed about the system and how it's different and why it's different and why we offer it.
Okay. And then as far as, Bella she touched a little bit on the training and the resources that she found really valuable. So for you as the provider, what are the InBrace educational resources that you have utilized the most and have been the most instrumental in getting your team, and InBrace really integrated into your practice?
Yeah. So the biggest thing for the team, like Bella said, is the on-site training. It's amazing. They really do a lot of hands-on. They get to learn from each other. They get to learn from clinical trainers at InBrace. They get to see the system up close. They get to think about what they're doing. So it's not just like, oh, I'm just putting color O-rings on a brace. They actually realize what they're doing has different effects and side effects. And if you do it one way, it does this. But if you do it this way, it can have a this effect. So they really become really great problem solvers so that they're like the mini doctors in the chair, problem solving and kind of making things run more efficiently without me having to kind of solve every problem because they understand the system, which is great. For me, the online resources are amazing. The mini residencies and the new updated mini residencies, the clinical guide, just looking and kind of seeing those up close at first can help you understand the bracket system, but just understanding the different case selections, why to treat ones differently. The Activate course is amazing when it comes to how to set up your cases and how to, make sure your cases are flowing well through their initial setups with your smile design. So the more you invest in that, the even more efficient this can go. So there's really the only limitation on how InBrace can work is really the provider. So the more you educate yourself, the more you set up your cases well, the more experience you get, the more efficiency you can get from your system, which certain systems they burn out. You can only do so much with a bracket and a wire. It can't move faster than it can move. There's slop in the system. There's, different variables with friction that you can't account for. So you can only move certain speeds with certain systems. Aligners, of course, have their disadvantages with them being intermittent forces. So when you get a system that can run at 100 miles per hour, as long as you're making sure that it's running efficiently, you can start to see those treatment times and the patient appointments all go down, which is amazing.
I love that. And I love how you continue to just really give, a shout out to your team and how they are so instrumental in helping you get all this done too. And, that being said, and this might be a question just to jump back to Bella, maybe, how has all of this empowered and impacted your staff?
Yeah, I can see it in their eyes when they start to learn InBrace. They start to realize like what they're doing is, and it's like the same spark that myself and I'm sure Dr. Jenny and all the orthodontists on this call have. When you first learn about orthodontics and how exciting it is, like putting together puzzles and understanding the physics and the biology and how they all interact to make smiles work, like you start to want to learn more. And it's like a never-ending learning cycle, which makes you feel more ownership for your position and makes you feel like, oh, wow, I can really answer the patient's questions well. I understand what I'm doing, why it's happening. I can see the progress. Since we take photos every visit, that helps us with that as well too. So like you really start to buy into like, wow, what I'm doing is an amazing field. And that's why we all became orthodontists, because like the way that we can change lives and the way that my life was changed with orthodontics was amazing. So Bella, do you want to talk some more about that?
Yeah, I just think learning InVoice, once I learned it and I knew I could do it by myself without any help, it gave me the confidence that I knew that if I can do InBrace, I can probably do anything.
Oh, I
Yeah,
love
like
that.
she was
Thank you
saying
for
earlier.
sharing, Bella.
Yeah, like she was saying, the mechanical skills you learn by being, ambidextrous and having to use your right and left hand and, positioning all that together makes you more efficient in other areas.
It's amazing. And Dr. Horsey, you have shared so much. You've given such great insight on today's webinar. So I'm going to leave you with a very similar question that I ended with Dr. Jenny and Tracy and Bella also. Now being a seasoned InBrace provider and leader within the InBrace community, what advice would you give to new providers starting off with InBrace?
Yeah, I would say one, try it. You'll love it. Your support is there. They won't let you fail. Two, I would say take photos every visit. That'll help you understand what the system's doing and how it's working. You'll see how efficient it is. And then train your team. Train your team, invest in your team, send your team to courses, give them the online resources, and bond it on yourself or a key person in your office, like a treatment coordinator or somebody who's going to be in front of patients a lot.
Well, thank you so much, Dr. Horsey. Always
Thank
a
you, Erin.
pleasure. Thank you, Bella. Thank you, Dr. Jenny. Thank you, Tracy. I'm going to now pass it off to Patty for final thoughts. And thank you all for joining as well.
Yeah, I echo that. Thank you all so much for spending a portion of your day with us in between your patients and everything. We really appreciate your valuable time. I want to head it over to the Q&A in the event that there's any other questions that we have. I did see one come in, Erin. Can a general dentist do InBrace? So right now, general dentists do not do InBrace. We are for orthodontists. So our system is a tool that orthodontists can use. I don't know if you have any additional insight into that, Erin, but short answer is no.
No. By orthodontists for orthodontists. That Dr. Horsey and both Dr. Jenny said. So the short answer, no.
If anybody else has any questions, please feel free to put them in a chat. Oh, there's a question here for Dr. Jenny. How does Dr. Jenny place the colors on InBrace brackets? Love that. Go ahead, Dr. Jenny.
So, and it's just a pop of color. Keep that in mind. But so when you have to use the elastics, we actually have them. So we use the clear bracket or the clear elastic buttons. And so then we put whatever color they want over that little elastic holder or the button, and they love it. It's just a little pop, so they feel like they're not missing out on the braces part of their life.
And then you can give them colored elastics.
Mm-hmm.
Oh,
That's a
cool.
great idea. Great idea. And I'm just going to touch on one more thing since you are talking about the pop of color, and I'm assuming that it's mostly like kids that you're doing this for.
Yeah.
Yeah. So what's the youngest patient age that you've treated in InBrace as well?
We've treated 9 or 10. 10. Don't be afraid to treat adolescents. This is actually the best group to treat. So I mean, I can't emphasize enough. It's just a different treatment modality. So I don't hesitate in treating young patients. I haven't treated a patient with mixed dentition, but I wouldn't necessarily be afraid to do it.
Wonderful. Thank you so much. I also love that little interjection with the colored elastics. It's great because then they can pick whatever colors that they want to match their outfit that day when they switch out their elastics. So giving the people what they want, that's awesome. So I don't see any other questions come through. Thank you again so much. And I'm going to echo Dr. Horsey's sentiment. You know, it is wonderful to be able to bring a product like we have with the passionate individuals that we have on our team. It is more of a satisfying feeling and more immense to be able to partner with such truly amazing orthodontists and their teams. And really, the fact that you guys are just amazing human beings. And we are so grateful for you. We are so honored to be partnered with you. Again, thank you so much for your time today. For any of you who have missed some of this today or would like to come for round 2 on Tuesday, we have another showing of this webinar on Tuesday afternoon. So if you need additional details, please reach out to your technology integration specialist or business growth consultant. Again, thank you so much. Thanks again, Erin. You have been amazing, an amazing partner as always. And we wish you guys a wonderful day, and we'll see you back next time.
Thank you, everyone. Have a great day.